Good morning. Good morning. Good morning. Today we're going to be doing a little bit of shoulder stuff. Okay, so I have a theraband and I also have a strap. So we're going to be doing a combination of things that are going to help you to improve the overall function of your shoulders. Now remember, we're looking at our arm and the collarbone, the rib cage, the blades, the spine. I want you to choose something to sit on, whether it's a bolster, whether it's a block, whether it's a chair. I want you to choose something to sit on where you can be easily vertical. What I don't want you to do is to get onto the edge of a block and then do something like this, right? So you see how my pelvis goes into an anterior tilt? Sometimes people set themselves up that way because it makes them sit up, but it's not at all helping the connection between the pelvis and the ribs. So if you don't have a nice connection between your pelvis and ribs and what you do through your shoulder girdle, it's just you don't get the maximum benefit. So find a place where you can be easily vertical. So I'm on a bit of a throne here with a bolster and a pillow. Be on a chair if you need to, yeah? Right? Make this easy, right? The aim here is to build ease. Let's make this easy. Okay, so what we're first going to do, so we're going to first use the theraband. We're going to place it around our ribs and tie that up so that this acts as some feedback mechanism to the lower part of your ribs. All right, and we're going to start with a breathing exercise. So here, it's just an easy inhale and an easy exhale. And what I would like you to notice is when you're breathing, do you feel the breath here? Do you feel the breath here? Do you feel the breath here? Try not to make something happen. Try to just notice what's present and let the band be around your ribs. We're not going to use it quite yet. If you can't really feel your breath here, can you feel the breath coming in through your nose? Just notice where it is that you feel yourself breathing. And then, utilizing the band as your feedback, I want you to direct that breath to the sides of your ribs. So it's not about increasing the volume of your breathing because that will direct it to the ribs likely anyway. I want you to think purposefully about moving your breath out here. Watch that you're not going up through here. So you're breathing through the lateral side of your ribs. So think about the ribs moving out wide. And then move it into the back of your ribs. All right, lovely. And then take that away and now let your normal breathing pattern emerge and be aware of your breath. Now, there are people who do that exercise who will automatically feel neck pain and strain just vanish. Not everybody, but some. And so those some of people, what they'll notice is a relationship between how they breathe and how their rib cage perhaps is and what goes on through their neck. So they see that as a correlation. So then they can start to piece that together, build some stamina and new pattern around that breathing pattern, and they can have less and less and less neck pain, right? Now, from that, I want you to just be aware of the breathing as you bring your arms up overhead. Elbows can be bent to start, and you're going to start to take the arms in a circle. Now, what can be typical is something like this, right? So the articulating joint is the arm bone in the shoulder socket. Not the ribs. So we're not doing the hula. Although the hula is kind of fun. There we go. Arms in socket. Okay, lovely. Now let's take strap over the shoulder. Arm comes up alongside the ear. Bend the elbow, grab hold of the strap. Other arm moves into extension, rotation, grab hold of the strap. Now you'll notice when I did that, my rib cage was nice and quiet. All right, so now notice that as you do it, how that rib cage is. So the movement was all about your shoulders, elbows, shoulder joint. And then come back to your breath. And then let that go. Okay, other side. Arm comes up. Be aware of your breathing. Hold on to the strap. Be aware of your breathing as this arm comes this way, rotates, and then grabs the strap. It's so easy to just move ourselves into positions when we know what they are and not be aware of the breath. Okay, and let that go. Strap comes to the side, and now just be here and notice if, having done that shoulder movement, if anything has changed in the way that you're sitting. Okay, one arm across, elbow. So make sure that this hasn't happened. The movement is this. Just straight across. And then from here, rotate that arm bone in the shoulder socket. Watch the breath. Be super, super easy about this. Remember that ease can be the undercurrent, can be the foundation of power and surge. Bring it across. You'll be hearing about a program very, very, very soon about the older adult I'll be launching very soon. And this notion of ease is so vital as you move into your later 50s and 60s and 70s and 80s. So incredibly vital. And so a thing to think about is like practice for the next decade. Right? I'm in my 40s. Practice for the next decade. Practice for the next decade. Okay, now notice having done that. Now we're going to move into eagle. I know some of you who are following will not be able to do eagle, so please, if it makes sense, come back to this one, or back to this one, or something else that makes most sense. So arms are going to come out if you're going to follow. Cross the arms. Now if you want to hook the hands, you can. Good, and then other side. Now you might lose my mic as my arm comes across. All right. Now notice what you feel. Shoulders come up. Blades come back to your spine and then down. Shoulders come up. Blades come back to your spine and then down. Easy breathing up, exhaling back and down. Up, exhaling back and then down. Really, really easy. Just pay attention to your pelvic floor for a moment. And as you're moving, are you finding that it's like lifting and gripping? Are you holding in your ribs? Can you do this movement with 10% more ease? Or another way of saying it, 10% less effort, but still have the same result? All right, lovely. Now just sit and feel. Okay. Now, let's take the theraband around your ribs. Okay. Here. Now you're going to move this forward. Let me show this from another angle. You're moving this forward. So I'm not setting my shoulder blades. I'm not holding my shoulder blades down. My shoulder blades are just where they are on the ribs. What's moving is my arms moving out forward like this. I'm not doing that. I'm not doing that. I'm just moving forward. So notice, right? The tendency as teachers particularly will see this happen and go, oops, pull them down. Nuh-uh. Just notice where your blades are. Just notice where they are. Now move your arms from that point. Now you might not be straightening your arms all the way. That's totally cool. You don't have to. Just find the range that makes sense. You might feel something in your elbow or your wrists. You might notice your head poke forward, or you might notice any bazillion number of things that we do to compensate. So maybe your range is just, maybe you do this to start. I was working with a client yesterday and that's exactly what her range was. It was just this. That's fine. That will come. Tissue will change. Remember, strength is really, really easy here. The undercurrent of strength is neuromuscular communication. It's how our brain and our tissue is talking. So when you move well, you gain strength. Compensation ultimately leads to weakness, right? Or said another way, maybe weakness is maybe not the kindest word, but it's you're not as strong as you could be because you're using body parts to do something that they're not designed to do, right? So you don't get the bang for the buck. You don't get the juice from the lemon. You don't get like the good stuff because you're you're just doing it in a way that's not quite as effective. Yeah? Okay. So this next one, we're going to be taking our arms out like this. Okay? So you'll see that it's a horizontal movement here. So a lot of times when people try to do this, they want to bring the shoulders up, or they want to hold and set those shoulder blades down. Let's let those shoulder blades be free, right? But be aware of where they're going. So we don't need to cramp them into a cage. We need to train the system to be adaptable and responsive, not held. Yeah. Okay. So we're going to fold the theraband. Now you're going to have maybe a different color than me, and you know how the colors have different tension, right? So you need to decide where you put your hands. The more narrow you put your hands in the theraband, the more challenging it will be. The wider you put your hands in the theraband, the easier it will be. Let me show you. So here, and I hit my breastbone like this, right? Now, if I have my hands really narrow, then it's like, right? That's a lot harder to do. So you choose where you want to have your hands. So hands, you're not like white knuckling them. Arms come wide. Allow this to be through your shoulders, not in your neck, not in your back, not in your elbows, not in your jaw. Have it be in your shoulders and your arms. Good. All right, and let that come down. And now just be and feel. Notice what goes on in your abdomen. Notice how you're sitting. Feel your breathing. Notice if that's changed at all. And whatever changes that you're experiencing, whether you are noting them as positive or as not positive, recognize that you've just gained awareness of things that have worked, things that have not worked. And those are the steps towards recovery and healing. So you might find yourself in the absolute perfect position to move into a meditation practice or into a pranayama. Or like me, you might be ready to go for a cup of tea. Whatever you choose, enjoy your next step. Enjoy the rest of your morning. Enjoy your shoulders. We'll see you on Monday. Take care.